Welcome. My name is Natasha Sherman and I am your host. And my guest today is Lisa Klein. Lisa is a physical therapist as well as an integrative manual therapist, or in short form, IMT. And she's here today to talk about that and about an alternative healing methodology. So welcome, Lisa.
Thank you.
So, alternative kinds of healing and taking care of our health is becoming much more mainstream. So it's not either this or that. For me, integrative manual therapy is something new, and I found you on YouTube. And what I really found fascinating was that there are things that we can do on a daily basis that seem really simple and that can be powerfully effective. So I'd like you to talk to us just about what is integrative manual therapy.
So integrative manual therapy is a very comprehensive modality that encompasses treatments for virtually every tissue in the body. And it shouldn't really be considered alternative because it's more basic science than anything else. So it's looking at the anatomy, the physiology, and the mechanics of every tissue in the body and how to fix it when there's a problem.
So when you say looking at, so if a doctor says we're going to look at the tissues in the body, whatever, he's going to do some, technical stuff. They're going to take x-rays, etc. So when you say looking at, how do you as a therapist look at?
We mean feeling for. So every tissue in the body has its own movement to it. So how we're trained is to feel through the layers of fascial tissue and find and locate areas of inflammation and scar tissue and treat those areas. So we're looking with our hands.
Okay. And for some people that may sound far-fetched, but having been a massage therapist, I totally understand. You're seeing things through your hands. Yes.
Yes.
So what additional training? So you're a physical therapist, but what kind of training did you do to do?
So when I was in physical therapy school, the anatomy, the physiology, all that was great. The treatment techniques I didn't think were fabulous. So I started looking for people who really knew that piece of it. And I studied with many different practitioners until I found the ones who I thought were the smartest and had the best information and were getting the best results. And so I've taken close to 100 classes over my PT training, mostly in manual therapy and mostly through the developers of IMT.
Wow. So talk to me about some of the things that you can do that perhaps are that the successes you've had.
Okay, so most people don't realize that a lot of their problems are from accumulated load on tissue, meaning one thing can happen and it's not that big a deal, but when several things happen, then you can start having problems. And for most people, if you take the time and talk to them and try and feel for what's going on, you find an injury, you find an infection, you find something that caused the problem.
And then...
does that make sense? So
Yes. And it's just like, when people have surgery and they have scar tissue, and that scar tissue can impact all of their tissues in their bodies.
Yes. Right, but what people don't realize is every time you have an injury, there is scar tissue created. So we have so many patients who had injuries when they were younger that cause scar tissue, and then they have to grow on that scar tissue. So many of my patients had head injuries, car accidents, falling out of a building. Something happened when they were younger that as they grew started causing more problems. Or they could have had a significant injury as an adult that is never fixed and causes problems. So this way of treating looks at every tissue, everything, to try and get it to reset back to neutral.
So it's kind of stunning. It makes sense.
It's fabulous.
But we don't think in those terms. We think everything is localized and just treat the localized, presenting problem, and then it'll get fixed. And what
in the U.S.,
yes.
In Europe, they are much, much, much more aware of this, and we treat more like classic European osteopaths than American physical therapists. So in Europe, the field of working on fascial tissue and fascial work is much more accepted than the U.S.
Wow. Is this similar to myofascial treatment?
Myofascial release is the foundation of what we do.
Right.
And now it's taken to an extraordinary degree of detail.
Okay. So if I came to you, let's say I came to you with a problem. I have chronic lower back pain. I don't, but we'll pretend. And so somebody sends me to you. What would happen? What can I expect from you?
So we map the body to see if we can figure out where the problem is.
And when you say we map the body, what does that mean?
So we are trained to feel for lines of inflammation and scar tissue in the body. Mm-hmm. And then that's work to release. Mm-hmm. So we don't treat areas that are being affected by radiating pain. We treat areas that have actual problem. Okay. So that makes it quicker to find instead of chasing symptoms.
Quicker to find the problem rather than chasing.
Yeah. Chasing symptoms. So because if you've had pain for a long time, you don't really know where it's coming from. So we're trained to find where the pain started, the actual problem. Right.
So I just want to tell our audience that the last half of this interview, you're going to be demonstrating, somebody else created this video with you, but it's very powerful. You're going to be demonstrating techniques that we can do at home. So I have a question about one of the techniques, and then I want to go on to some other questions. Okay. So one of the techniques is, let's say I have a headache, so I put my hand in the area of pain, and then I take my other hand and I put it at the small of my back.
Yes.
And what if that hurts when I do that?
That should not hurt.
So the shoulder starts to hurt.
Oh, if it hurts your shoulder.
Yes.
Okay, so then you would take your left hand and put it on your shoulder and process your shoulder.
So process the shoulder first. Okay, got it.
And you're using the back of your hand with the right hand?
Yes.
Yeah, that's fine.
Yeah.
Yeah, you have to get your shoulders released first.
Okay. And I've been using it for sleep.
That's great.
Yeah, and I just, watched your video about a week ago, but I'm finding it already useful. And particularly also what you suggest with kids. So I invite people to stay tuned so they can see.
Yeah.
So then there's something here. The practitioners of IMT assess clients by using their hands. They feel the body's circadian biologic rhythms and movements.
We do, but it's also scar tissue. Sorry to interrupt you. Yeah.
No, that's great. I want you to clarify. So it is scar tissue. And you're saying every time I injured myself as a kid and fell down and bruised myself, that left a lasting impact.
May or may not. It could be how bad it was.
Right.
So little areas, maybe not a big deal, but we have people who had hoops injuries. Falling that far as a child is not okay. So it depends on how severe the injury, what part of the body it affected, and whether or not that will determine whether or not there's a lasting impact. So we have a child we treat who was 1, and when he was 5 months old, he fell face down as a 5-month-old off of a bed that was pretty high. That's not good because it locks down a very critical part of the head. So the worse the injury, the worse the area that is affected, that will determine whether or not you have problems later.
Wow. So in my research online, and they talk about even treating attention deficit disorder. Is that accurate?
Yes, anything that has as a presentation has a structural correlate. Structure dictates function, period. So no matter what the problem is, there should be a structural problem that you could find and then hopefully treat.
Wow. So in this part of our interview, we've got like 3 minutes left. What is it that you would like to tell the audience in terms of what to watch for, what they can do, and other than watch the rest of this, just any advice?
Just realize that no matter what you're experiencing, there's a reason. And just because traditional medicine hasn't been able to figure it out, doesn't mean it's not fixable. And a lot of times, with the time and the effort, you can turn around a lot of issues. We work with pediatric neuro. We work with patients who have had severe injuries. And telling a patient that there's nothing you can do, too bad for you, is not okay, no matter what the problem. So we try and figure things out. And if we can't do it, we send to somebody else. But again, medicine, for it to say, too bad for you, totally unacceptable. Always.
I like that. And medicine often does say that. Or,
yes.
There's the whole issue of over-medicating as well. But so we're going to watch the video that you did and, learn the techniques and the tools, your interview with Carol Maltz. And I appreciate you coming on and talking to us, but also for letting us use this interview that you did with Carol. So thank you so much for being here and for the work that you do.
Sure. Yes, and actually Carol was very nice to allow that. Oh, great.
Yeah, I appreciate that. All right, thank you, Lisa.
So I'm Lisa Klein, the Director of Total Health Physical Therapy, and what we're going to go over today are a few of the simple home program points that we give patients to process in between their treatment sessions. And we found that these are very helpful when patients are recovering from an injury or a trauma. And they make it so that their progress when we work on them is actually a little bit faster because it makes things continually in motion. So the first one that we give to patients is something called taking the area where the problem is to the area of the body which is around the area of the ureters. So the ureters are the tubes that go from the kidneys to the bladder, and they are kind of deep in there, but we access them by putting a hand on the lower back and the small of the back. So what we do is when we have patients who come in who have, headaches or pain or whatever, we want them to have a way of continuing to bring the inflammation down in between treatment sessions. So what we have them do is put a hand on wherever part of the body is bothering them. So what we would do is say the patient's coming in with headaches, we'd have the patient put a hand on their head and the other hand across their low back, and you can use the back of your hand. You can use the back if you want to, And it seems like a very simple thing to do, but what we found, and we've actually done trials with this with the neurofeedback leads on the head, so we see changes in brainwave function. It's fascinating. But when you have a hand on the ureters, what you're doing is you're cueing the body to drain fluid, because the ureters, they have the fluid that comes down from the kidneys before you pee it out. So basically what they do is they drain fluid out. They help in that process. So what we do is we have the patient put a hand on their head and then the other hand across the low back. And again, it seems like a very simple thing to do, but it's very helpful in getting fluid to start to flow out of a certain area. So we'll have the patient hold in this position for about 20 minutes. I tell my patients this is their official excuse for watching TV, because you can say you're doing your homework from your physical therapist. So that's fine. You can watch all the Homeland you want. So
can you do it laying in bed?
You can. It's not as comfortable because of if your shoulder's okay with that. But yes, you can laying down, sitting up, whatever. There's no positional issue there. All right. Say if you're coming in with a lot of difficulty in the chest, for whatever reason, you can put a hand on the chest and a hand on the ureters. You can also do this. This does help move emotional issues out when things are really not moving. So if you've had a hard day at work and you're emotional, you can put a hand on the heart and a hand across the low back. I had a patient who came in the other day that saying his heart was broken. Poor thing. So we sat there and processed his heart a little bit to help him out. And so any area, you can do it on the belly, just any area where you're having an issue. So you put a hand on the area of the issue and the other hand across the low back. And what my patients will say is that it may take, you can relax your arms, that it may take a few times doing it, but after a while they actually feel something. They feel heat coming out, they may feel tingling, they get very tired, they get very relaxed. So if they don't feel anything the first few times, I just say, just stick with it anyway, just do it. And because it does make it easier for me to treat them. But after a while, every patient who's come in says, I really was just getting tired and I was relaxed and I felt this and I felt that. And once they know that it actually does something, they end up, processing their husbands and their kids. So it's a very nice kind of tool to have. So again, the first thing that we're going to teach you is for first aid. Wherever you're having the issue, you put one hand there and then the other hand across the low back, and you'd hold for about 20 minutes. So another processing area that we give to patients when they're recovering from an injury or a trauma is to process the heart. The heart, as you know, is the center for many things in the body, the main thing obviously being circulation. So often when you have an injury or a trauma, you want the circulation to that area to normalize. Whether increase it, decrease it, you want it to be back to normal. So wherever you're having an issue, I have a patient now who just had a total knee replacement that's not doing so well. So for her, we'll give her one hand's on the knee and the other hand's on the heart. And what that will do is start to normalize the communication between the area where the issue is and the circulation, okay? It's kind of a strange concept, but every part of the body is always communicating with every other part of the body, and that communication needs to be in the category of normal. So too much communication is not good, too little communication is not good. It's like you're at a dinner party, and everybody needs to be talking nicely with each other. If two people are yelling, or if one person isn't talking at all, that's not good. So we want you to be having a happy dinner party in your body.
Sounds good.
It's a very social way of treating that we have here. So what we do, again, is you would have, for this technique, you would have a hand on the heart and then a hand on an area of the body where you're trying to improve the circulation. This is great for people who have had infections, swelling that won't go down. It is good for headaches. We're going to cover that actually in a minute for headaches. But after you've had any kind of surgery, when that area needs to have the circulation restored to normal. And the thing about the heart is that it is not only the center for circulation for the body, it's hugely important for life. Just everything about your life, it should be kind of affecting your heart. So many people, as they go through life, take hits, you have issues and yada yada. So the heart really takes a hit. So referring back to the first video, one thing that you can do that's very therapeutic is a hand on the heart and a hand on the ureters, like we talked about. And that's a really nice way to kind of drain anything that may be affecting your heart and help it to move out. And it's just, when people do that, I cannot tell you, it's just, I'm getting relaxed right now. Aren't you getting relaxed? Fall asleep.
I haven't done it enough yet, but I
it's
believe
very relaxing, all right? So especially when somebody's been through anything that's traumatizing, we do a lot of heart work. It's very helpful.
And how long would you hold this?
So when we do these points, we hold them for about 20 minutes.
Oh, okay.
And patients have asked me, well, what if you sneeze or cough? It's like, that's fine. You don't have to start over again. You just pick up where you left off. But also, when patients are processing, often they find areas that feel really relaxing. Like the heart, to me, feels really, really good. And so I could do this for hours because it's just super relaxing for me. So again,
it does feel good, actually.
Isn't it really? It's
Yeah.
nice.
Mm-hmm.
Children love this. This is great for boo-boos. The younger, the more open they are. And when you work on kids, they just get all melty. Yeah, if you ever want to relax a child, this is a nice way to do that. So the next connection we're going to go over is something that most people really like to do because it's helpful, is if you want to improve the functioning of your frontal lobe, which is where memory, cognition, concentration, all these things are in this part of the brain. And for most people who come in, again, we have a very detailed intake form. 8 times out of 10, people fill in, they have difficulty concentrating. It's just incredible. So what you would do for this one, you should have a hand across the frontal here, above the eyes, and then the other hand would be in that area across the low back. Okay, and what you could do is you would hold then for about 20 minutes. This is also, it's okay for headaches, but we're going to go to a different one in a minute for headaches. This is wonderful for stress, for difficulty concentrating, for difficulty with just any function of the frontals. If you take your pinky and actually drop it onto the bridge of your nose, at that point you're getting one of the access points for the limbic system. So if you have a rage issue, it can be very helpful. If you're in a survival crisis, if you are just having a bad day, if you're having a temper tantrum, if people around you are having temper tantrums, this is the way to kind of kibosh that a little bit. It's quite lovely. So if your hand's already here, you might as well do this because it's quite nice. So, and it's super relaxing. It may help with sleeping, although we're going to cover another one in a minute. That's good for sleep. So this is just a nice way to kind of bring your brain back into calmness. So the next point that we're going to go over, the connection, is something that, again, most people in Washington really need, I have to say. Not me. I'm never stressed, ever. But so most people who come in have a lot going on and they're a little bit stressed out. So it's the adrenal glands that process that stress, and they produce cortisol and all those nice catecholamines. And what they do is they perpetuate a stress response. So sometimes once you're in a stress response, it's sometimes hard to get out of it. So that's why processing the adrenal glands is very helpful. The only thing about them is that they're a little bit hard to reach. So I'll show you how to reach them. The adrenal glands sit on the kidneys like little hats, and when they're under load, they just scream bloody murder, and they just load. All right? They love getting treated. Love it. And with patients, when you do this, even if they are kind of hard to reach, you will feel yourself relaxing. So what you do is you would put a hand on your back, and it's about, for women, it's about bra strap level, because you want to be above the kidneys. So I usually use my hand like that, and then my other hand across that small of the back area. And as soon as you touch it often, you can start to feel like, oh, I feel that's doing something. Again, not for me,
Totally.
because I'm never stressed.
I am not kidding.
Do you feel it?
Yes, and I'm not stressed too much.
We're never stressed.
But I can feel this. Yes,
Yeah, it's pretty
instantly. Yes.
We do a lot of adrenal work. Adrenals take a hit big time. So stress is processed in the adrenals, period. So this is a very relaxing one to do. Very relaxing. It's great also for cardiac patients because you'll feel it in your heart. Your heart will start to calm. And it's great for children who have had trauma. I had a patient yesterday who adopted a child from China at age 4, and I was giving her this to do for him. He's doing better, but little boo-boos get so stressed out, so this is a really nice thing to do to calm them down.
Now,
So I'll show you, if you were going to do it on someone, I'll show you how you can do that. So you would just have your hands, you can take your hands down for a second. So you would just do like that. And you use the palm of your hand if you're doing it on someone else. Again, for you, it's very hard to do it with the palm of your hand because the placement's so high. What was your question, Carol?
you just answered it. I was going to ask you if another person could do that
Absolutely.
for someone else.
Yes. And the more patients use the processing, the more they do it on the people around them, because you can start to say, oh, you're very uncomfortable. Let me help you. So, and I can't even tell you how effective it is with children, because children are so open and they love to be touched anyway. So you don't have any issues. And even I've worked on many autistic children, they love it. So even kids who you think are tactilely defensive, if you kind of start to work on them like this, it's usually they are just totally into it. Mm-hmm. So the last one that we're going to do today is involving the back of the head, which is a really nice area to do for general calming down from a neurological, but also it's great for headaches. One of the main reasons for headaches, whatever kind they are, is because the drainage of fluid is not so great coming out of the head. So the body's really good at making sure the brain has enough blood, but sometimes not so good at getting it out. All right, so and if anybody has eye headaches, pressure headaches, migraines, this is usually helpful. It may not fix the problem, but it'll help take the edge off a little bit, or it should. So you have a hand on the back of your head, just right where your ponytail is. There you go. And then the other hand goes in the back of the back here, on the small of the back. Okay, this is one that people often do when they're going to sleep, because the sleep center is in the brainstem, that reticular activating system. So for people who are having a hard time getting to sleep, we'll give them this processing to do, and it may calm them a little bit. This is also a fantastic one to do for irritated children or irritated people in general, because it puts you into an immediate parasympathetic response. It's a calming sensation, the back of the head being touched. Okay, so often people who are agitated, you can do that and see if that'll kind of calm them down.
My name is Natasha Sherman. Thank you for joining us.